So my name is Scott Rhodes. I'm from Wake Forest School of Medicine. And our project has really been looking at the role of immigration law on access to services, to public health services, specifically among immigrant Latinos living in North Carolina. What we found was that there was not necessarily a difference pre and post immigration policy implementation for prenatal care, for example, within Latinas. So before the policy and after the policy, there was no difference. The difference was, though, that Latina women, Latina moms were already less likely to seek prenatal care, sought prenatal care later after pregnancy, and those who did seek care had fewer visits than other women, white women, African-American women. So what we really learned is that it's not necessarily what happens at the county level. So we were looking at county level policy developed based on a couple federal laws around immigration and documentation. So what we found is that, North Carolina, for example, we have 100 counties, right? So there's not really the distinction of county to county. So people are just fearful of care, of seeking care. So it didn't really have to do with what was going on internally. It's just a general, national immigration debate, the fear of, of not knowing what people are what they're eligible for, not knowing what's going to happen if they do seek services, and are undocumented. So clearly there is a need for education. So clearly, what Latino community members were saying is, we need to tell our story. Our stories have to be heard, but then on the flip side is a lot of folks don't feel safe telling that story. There need to be some changes at health departments, for example. If you walk into a health department in North Carolina, there's a security guard. So that already is scary for folks. Then you walk in, you deal with frontline staff, and really what the issue is, frontline staff tend to have sort of less training in less training on how to work with folks that are different, quote unquote. So what we learned is once you get to a nurse or a physician within the health department, you get more culturally congruent care, but it's sort of the frontline staff that actually can become a barrier because they don't have sort of the training. So we learned a lot of ideas really came to the forefront. We really wanted to use an empowerment-based approach because we're just a small research team, right? So what we want to do is sort of rally folks, get folks thinking about what can you do as a health department director? What can you do as a supervisor within the health department? What can we do to help community members know their rights so that they know what they're eligible for and what it takes to get services?